welcome today with a condition in pediatrics called the Integrated Management of Childhood Illness, abbreviated as IMCI. So, when talking about IMCI, it is a way of delivering childcare services in which the contact with the child brings together all possible ways and means for care of child and mother. IMCI for this discussion will be discussed in three parts. That is the general information on IMCI, then the IMCI process for children aged 2 months to 5 years, then also lastly infants aged 0 to 2 months. Let us understand what the acronyms IMCI stand for. I is for integrated, referring to bringing together curative, preventive, development aspect of childcare into one strategy in addition to the proposed management approach. Then M is for management. Here should be seen as having both a clinical, preventive, and a promotive part. Then C is for childhood, referring to children under 5 years, the child age group most vulnerable to illness and death. Then I is for illness. This is used to address a condition that are faced major cause of death, severe illness, or disability in under 5 children. And let's have now our introduction to IMCI with the acronym explained. So IMCI is a step-by-step process, a step-by-step management that helps to look at the entire sick child so that major signs and symptoms of illness are not overlooked. So it's a step-by-step or a step-by-step method of looking at the entire sick child so that we do not miss major signs and symptoms of the illness, or we do not overlook major signs and symptoms. Integrated management of childhood illness has 6 modules, where we have module 1 and module 2, okay, module 3, module 4, module 5, and module 6, and they have specific things that they look at. So when you talk of module 1, focuses on assessing and classifying a sick child aged 2 months up to 5 years. Module 2, this one takes you through identifying the treatment. Then module 3 covers treating the child. Then module 4 looks at the counseling the caretaker. Module 5 looks at the management of the sick infant, and module 6 mostly takes you through the follow-up visit. What are the learning objectives for this lesson? At the end of the presentation, you should be able to describe the concept of IMCI, should be able to assess and classify the child or the sick child aged 2 months up to 5 years, should be able to identify treatment for the child, should be able to counsel the caretaker on caring for the child's health, growth, and development. So the other objective is to discuss the management of sick young infants up to 2 months. Then the objectives of IMCI is to reduce significantly mortality and morbidity associated with the major cause of disease in children. The second objective is to promote improved growth and the development of children. Definition. IMCI, as defined before, we are saying it is a holistic strategic approach to child care that combines a curative, preventive, and developmental care aspect of children under the age of 5 years at home, in the community, or at the health facility. The approach was developed by United Nations Children's Fund and the World Health Organization in 1995. Age focus for IMCI in children. Treatment guidelines are for children under the age 5 years of age. These are divided into two categories. We have young infants aged up to 2 months. So all sick young infants under age up to 2 months must be examined for signs of possible serious bacterial infection. Then we have children aged at 2 months to 5 years. So all sick children of 2 months up to 5 years must be examined for general danger signs. Advantages of IMCI. The first advantage is that it focuses on the care of the child as a whole and not on the reasons for the visit. Number two, it ensures the early identifications of all seriously ill children. Number three, ensures integrated management of all prevalent illness that the child may present. Number four, it includes the application of preventive measures along the treatment for detected illness and health problems. Number five, it includes actions to improve parental practices in caring for the child at home. Number six, it can be adapted to the local epidemiological situation. Trainings in IMCI is basic integrated management of childhood illness, which is for 12 days, IMCI follow-up course for 5 days, IMCI on-the-job training, and there's also IMCI supervisor skills training. What are some of the basic job aids and forms in IMCI? There is the IMCI chart booklet, of which when you're following this lesson, you're supposed to have with you the IMCI chart booklet. There is also the IMCI patient logbook. There is the sick child's recording form, that is aged at 2 months to 5 years old. Then there is the sick young infant age 1 week up to 2 months. Then there is mother counseling card. What are some of the common causes of morbidity and mortality in under 5 children? So 4 most common causes of ill health and health among the under 5 within my national geographical area include pneumonia, diarrhea, fever that may be due to malaria or measles, and then ear infection. On other causes of morbidity and mortality within my geographical area includes acute malnutrition, tuberculosis, HIV. You have to note that children may also come with a combination of, let's say, HIV and tuberculosis. Some essential IMCI drugs at health facility include oral antibiotics like amoxicillin as first line, then oral antimalarials, first line temethal-mephentrine, second line quinine, nardicic acid tablets, iron, vitamin A, paracetamol, vaccine, antiemetics, vitamin A, chloramphenicol eye ointment, gentian violet, benzylpenicillin, gentamicin. Chloramphenicol is optional as it may cause anemia. Other essential equipment and supplies for IMCI include weighing scale, timing device, refrigerator with a voltage regulator, sterilizer, blood pressure apparatus, and also a pediatric cuff should be available. Then oral thermometer. Then other supplies may include cold chain supplies and immunization supplies. You can also have the oral rehydration therapy supplies and also have some water jars, IV fluids like Linger's lactate, and the insertion sets that are needed for cannulating the babies. Then sterile water for dilution, plaster, cotton swabs, and tongue depressor. The IMCI management process. When you're looking at the IMCI management process, we are looking at the step-by-step steps that are involved in IMCI. So the IMCI process includes 6 steps. So it requires to have knowledge and skills in the following 6 steps. 1, assessment. So It requires the knowledge in assessing the under 5 sick children. 2. Classification. It requires the knowledge in classifying illness according to severity. Number 3. Identification. It requires knowledge in identifying treatment for sick children. Number 4. Treatment. It requires knowledge to treat child or young infant and or refer the patient. Number 5. Counseling. It requires the knowledge of counseling so that the caretaker is given the knowledge that is needed. Then number 6. Follow-up. This requires the assessments that can be done when the child is coming for follow-up and other things that can follow. So, assess and classify sick child aged 2 months up to 5 years. You can ensure you record the following first: the name of the child, age in months, weight, and temperature. Then the steps that are involved in IMCI process, as discussed, we have talked about. This is just the simplification of the steps, that is, assess, classify, identify treatment, then counseling. Step 1, assessing the child for danger signs. So in assessing for danger sign, you can ask the mother what the child's problems are, then determine if that is an initial or follow-up visit for the problem that she has presented. If initial visit, you can assess the child as follows. A. Danger signs. Sick child may present signs and symptoms in various degrees. Therefore, determine whether the child has danger signs. There are: 1. Child not able to drink or breastfeed. 2. Child vomiting everything. 3. Child has or have had a convulsion. And 4. Child looks lethargic or unconscious. Assessing. You can check for general danger signs. If the child has had convulsion, you can ask if the child is not able to drink or breastfeed. Then if the child is vomiting everything, you can still also assess for that. Then when using sense of sight looking, you can see if the child is lethargic or unconscious. You can see if the child is convulsing now. So in checking for general danger sign, you ask for some GIT symptoms that are part of the danger signs: not able to drink or breastfeed or vomiting everything. So these are GIT danger signs. Then you can also look for CNS danger signs, which constitute the child being lethargic or unconscious, or see if the child is convulsing now. So you can check for danger sign, and the color coding for danger sign according to the triage of the IMCI is red. So make sure child with any general danger sign is referred after first dose of an appropriate antibiotic and other urgent treatment. There is an exception though. Dehydration of the child according to Plan C may resolve the danger sign for a child who is having diarrhea or severe vomiting and has severe dehydration. So referral may no longer be needed. General danger signs in summary. So the general danger signs include convulsions, not able to drink or breastfeed, vomiting everything, the child being lethargic or unconscious, or the child convulsing now. So there are some videos about IMCI that you need to appreciate, where there is a demonstration of these danger signs. Step 1. Whether or not there are danger signs, you can ask the mother and check for 4 important main symptoms or conditions. Does the child have a cough, and or is the child having difficulties in breathing? These are main symptoms, the 4 main symptoms that you need to rule out when you are seeing the child or you are observing the child. You can also ask if the child has diarrhea, Does the child have a fever, including malaria, meningitis, or measles? Or does the child have ear infection? For any yes, you can ask further questions and look and feel as needed. So in IMCI, you ask, look, and feel, okay, in that format during assessment. So the four most important main symptoms that you need to rule out for each and every child that comes to the clinic is rule out the cough, rule out diarrhea, rule out fever, and also rule out ear infections. So next you can check for acute malnutrition and anemia. You can check for nutrition status of the child, weight for age or anemia. Then you can also check for immunization status. Check for vitamin A supplementation, HIV status, and tuberculosis. Then you can examine for any other condition, e.g. skin condition and wounds. Step 2, classification. You can classify the illness. To classify means to make a decision about the severity of the illness. The classification of severity are color-coded triage system. The most children have more than one condition. Hence, each illness is classified according to whether it requires urgent treatment or referral, or specific medical treatment and advice, or simple advice on home management. For each of the child's main symptoms, you will select a category or classification that corresponds to the color for the severity of the child's illness. So the classification or color codes are as follows. So the following are the color codes for severity and the management. Red indicates a very severe and suggests a referral. B is yellow, indicates a moderate, initiating specific treatment. Then C indicates a home treatment with advice to the mother. Then you can classify each condition plus any other condition. For instance, nutrition status, e.g. pneumonia with underweight or diarrhea with underweight. Okay, so now here are the color codes and the measures that might be needed. So classification table, red, this is a severe classification, needs urgent attention and referral or admission for inpatient care. Then yellow, this is a moderate or mild classification for initiating a specific treatment. Green indicates home treatment with advice to the mother. So the mother on how you can give information and education to the mother on how to care for the child at home, as well as an example. Yes, how to feed the baby, how to breastfeed the baby. You may do that. You can classify each condition plus any other condition, e.g. nutrition status, pneumonia with underweight and the likes, using this color code. So red for severe, yellow for moderate, and green for a condition that needs just home treatment. So home treatment and the IEC. So the interventions have been discussed there. So you can identify treatment as step 3 of the IMCI process. After classifying all conditions, do the following. Identify specific treatment for the child. If a child requires urgent referral, give essential treatment before the patient is transferred. If a child needs a treatment at home, you can develop an integrated treatment plan for the child and give the first dose of drugs in the clinic. If the child should be immunized, you can give the appropriate immunization. Then step 4, treating the child. Treat means giving appropriate treatment in clinic, intramuscular injection or IV fluids. If a needs a referral, you can give appropriate pre-referral treatment and then refer. You can prescribe drugs or other treatment to be given at home, and also teaching the caretaker on how to carry out the treatment, such as oral antibiotics, antimalarial, TB drugs, inhaled salbutamol, paracetamol, iron, and folate. Then you can also teach the caretaker to treat local infections at home, such as a sore throat, eye or ear infection. Step 5 of the IMCI process is counseling of caretakers. Counseling can be on feeding. Use infant feeding counseling skills and assess the child feeding practice in a child less than 2 years of age if classified as having acute severe or moderate severe or not gaining weight or has anemia. Then B, you can assess the child's appetite. C, you can assess a breastfeeding practice for child less than 2 years. Positioning and attachment and exclusive breastfeeding in a child less than 6 months is cardinal to note any problems in the breastfeeding techniques. You can assess a complementary feeding practice with sustained breastfeeding for a child aged less than 2 months or 2 years. So counseling also can be on feeding recommendation during illness. Counseling can be to do with HIV for infants who are exposed. You can also counsel on how to stop breastfeeding when AFAS is met. Also feeding recommendation for a child with a persistent diarrhea. You can also counsel on giving extra fluid during illness. Other counseling may be needed on mother's health, breast condition, HIV status, and other immunization that the mother needs, like the tetanus toxoid. Step 6 in the IMCI process is follow-up care. Some sick children need to return to the health worker for follow-up. Follow-up visit is determined by severity and the type of problem, such as in 2 days or in 14 days. Follow-up visit determines if the child is improving on the drug or other treatment that was prescribed. Some children may not respond to a particular antibiotic or antimalarial and may need to try a second drug. So counsel mother on care for child's health, growth, and development. So importance, you can do some role play so that the mother can understand and also depict on certain things and wrong advice that may come within the community so that they can learn more of scientific facts behind those. You can give up follow-up care that is data when the mother can come, and children with fever or eye infection need to be seen if they are not improving, because you may need to do a thorough investigation. So IMCI process for children aged 2 months to 5 years. Follow-up, you can follow IMCI process as we have just outlined. So we have been looking at IMCI. We have just introduced IMCI lesson, and we have looked at the supplies that are needed for IMCI, the documents that are needed for IMCI process. So those are some of the things that we have looked at, and then we have looked at the steps that are involved in the IMCI process. So you can have some exercises on the same and see how you can apply the steps in IMCI management. Okay, like checking for danger signs, okay, checking for the 4 main symptoms. You can do that so that you better manage your children according to IMCI. So the next part of the lesson will be discussing each and every conditions under IMCI so that we understand how we are managing them using the steps that are involved in the IMCI. So we are going to do that looking at each and every condition, and there are some videos that have already been recorded on IMCI that you can still watch. And this lesson is a PowerPoint presentation on IMCI, and we ensure that we cover everything within this PowerPoint so that we fully understand what is involved, and we can take one note from this presentation on IMCI. So thank you very much for listening, and stay blessed.